Hey folks, this is a set of clips that Ryan made the day of my surgery. Some footage before I went in of talking to my doctor, Sonny Cavazos, who is a fantastic doctor. Can't say enough good things about him. There's also some footage after my procedure where I'm talking to a nurse who I believe was Vanessa at Foundations Surgical Hospital. I think it really shows the high level of care that I received. They're really great people, and excuse me, even though it wasn't all puppies and rainbows, overall I think I got the best possible experience under the circumstances. So if you want to get a feel for kind of what my day was like, here's some of it.
Where am I at, Joseph? In your one. Behind the curtain.
Hello. I'm in the hospital getting ready to go into my surgery. And
hey
my
man,
doctor.
How you doing?
Hey, it's good to see you.
Hey, how are you?
Dr.
No
Cavazos.
Hi.
No way.
This is my mom.
Hey.
Hi, it's Sonny Cavazos. Nice to meet you.
Nice to meet you, little young doctor. My goodness, they said that you were very young looking.
I look a lot younger than I am.
How fortunate.
I'm sorry, I was just video blogging.
Cool, man. All right. Well, let's see. You got your things on your legs?
Yep, the
Okay.
stockings.
Okay. You got your antibiotic. You should have some IV fluid. There you go. They give you your shot.
Yeah, shot right there.
Perfect. Okay. Let me look at your stuff real quick. You're all set and ready to go.
All right.
Any other questions for me?
I opted not to bring the jar. So.
Oh, yeah? Yeah.
Yeah, I looked at a video on YouTube and it really was as gross as
It's grody. I can't imagine having that thing around, but I don't know. It wasn't a bad question. Yeah.
Yeah, I'm ready. I'm a little nervous, but
All right.
I hear you're the greatest. So,
Yep.
Well, I don't know about that, but I tried.
yeah.
All right, man.
All right.
Ready to roll. I'll come see you here in just a little bit. I'll come find you guys as soon as we're done.
Thank you very much.
So
Okay.
nice to meet you.
Nice to meet you too.
Thank
okay.
you.
I'll come find you in a little bit. We'll take good care of him.
Thanks.
All right. Bye-bye.
Bye-bye.
You still recording?
Yeah.
So he was really good in Pineapple Express, and 127 hours. And what other movies has he been in? Yeah. So that was Dr. Cavazos. He's a good dude. He looks about 12, but he's very experienced. And I talked to him about keeping my stomach in a jar, and he told me that's cool, I could do it, but that it would be really gross. So I watched a video on YouTube, and it was really, really gross. So that canceled my plan to sell it to the people on the oddities to help pay for my surgery or to freak out people I work with. So I guess a little bit, they're going to open me up and cut off 80% of my stomach and hopefully give me some really good drugs.
Dr. anesthesiologist came and saw you and spoke to you.
Sorry. Thanks.
I raised such a polite son, didn't I?
Yep.
I really did.
Should talk about needing one for my beard, do I?
Really? I think you got more hair than your
There's not a whole lot on the head.
Oh, I guess we have to give you a hug now, huh?
Excuse me, I'm going to bring this around.
So this is the last time I'll see them before I go?
Yes, and you're going to get surgery, go to recovery room, and then to your room. Dr. Cavazos will come out and look for you in the lobby when he's done.
Okay.
And then it'll be a while when the nurse comes to get y'all that he's in his room, okay?
Okay.
Love this side.
Is your head good there? You want to go down a little bit?
Oh, I'm good.
You're good?
I'm just got my foot tangled up in the sheet.
No allergies.
I love you.
Oh, just the garlic. Where's John boy? All right,
Okay.
we're ready to go.
Later, babe.
I love you.
Love you too.
Hi, sweetie.
Bye.
Enjoy the ride.
I just asked for your arms to be in at all times during the ride.
Ciao. I mean, goodbye. I want to talk about food.
See you in a little bit.
Bye, babe. Love you too. Thank you.
Bye. See you in a little bit.
Yeah, I'm still working on it, yeah. Yeah, I noticed that you didn't have any of that on there.
Did they put a drainage tube in me? They had said they might need to.
You know, sometimes they do. You have a sleeve, right? Yeah, sometimes they do, and then sometimes they don't. With gastric sleeves, we don't normally see a GP drain,
Oh, good.
like a drain, so which is good because those aren't fun coming out either. So.
Yeah. Yeah, I watched a lot of YouTube videos and somebody was
Did
like,
you? You know, YouTube is not good to watch before surgery like this.
really?
Yeah, you know, I get patients that watch those for all different kinds of surgeries.
Yeah.
It just scares the bejesus out of them, I think.
I saw the crazy like one that's camera footage inside where they go in with the sleeve.
Yeah, yeah.
I watched that at 4 this morning. Probably shouldn't have.
Probably not, no.
When I was recovering, you know, he's getting his in a couple weeks. When I was recovering, I was like, don't do it. Don't do it. I don't want you to go through it.
Yeah, the first 15 minutes I was in here. I was
First
like,
night is the roughest. It really is, and then it gets so much better.
The first night?
The
So
first,
is it gonna
the
get
first, or the first day. No, I'm not saying it's gonna get rougher. No,
That's cool.
it's not. It's just that it's as the days go on, it gets a lot easier. So.
I'm just amazed that he's like walking around and
Yeah.
being as mobile as he is.
He's doing great.
Yeah, he's doing fantastic.
Oh no, not while you're here. Actually, tomorrow you probably won't be getting the morphine as much. They start you on loratadine elixir, which is a pain medicine, and that works so much better than the morphine.
Oh, really?
Yeah.
Oh,
They
good.
just don't like you to have anything by mouth the first night because they want your stomach to rest and everything.
Cool.
So.
Awesome.
All right, but no, you're doing great. You
Cool,
are.
okay. Thank you very much.
You're welcome. If you need anything, let me know. Okay.
Okay.
All right.
Thank you.
You're welcome.
Need a hand, babe?
I just want to sit up a little bit.
Okay.
God, I would kill for something to drink.
I know.
I started to gag on the dried up phlegm in my mouth.
Yeah.
Turned into dry. Hope you're not recording. Sorry.
Yeah, yeah.
Hey, baby.
Hey!
Oh, you're for me. Hey, Mom.
Hey, honey. Look at you.
Hey, you like my pantyhose?
This is a nice little area.
2, 3. I'm so popular. This is Scott. Yes. Yes. Sorry, that was about a prescription refill.
Hey!
You look thinner. Doesn't he?
I haven't eaten any food since you saw me, so.
Holy cow.
You look great. Hey, honey.
Wow. What a nice room.
Yeah, this is a great facility. So there you have it. That was my first day in the hospital, and a little tiny bit of this morning with me getting out at the end. I'm going to keep posting updates. For the moment, I'm doing pretty well. It's Thursday night, pretty late. I was discharged this morning, and I'm feeling pretty all right. been trying to get a lot of fluids. I've had a good amount of chicken broth, probably about 3 coffee cups full of chicken broth. I've had a good amount of water, and I've eaten about 4 teaspoons of gelatin. So, doing okay. And so far, I think it's not as bad as I feared. The first day really sucked, but the really hard part of that was only about 4 or 5 hours. And if that's the cost, I mean, the cost in non-dollars, the dollar cost is still on my credit card, and I'll have a couple of years of hacking away at that probably. But if those are the things that I have to do to get healthier, then so be it, right? So follow along on my Twitter. It's XKOT is my Twitter handle. I'm posting short updates throughout the day there. And our bariatric.tumblr.com, and it's spelled like bear as in grizzly bear, because we're very witty that way.